Agat Anish on Seanad and Nessa Cosgrave.
Margaret, agus fáilte Roach Minister, agus Eireann Tála.
Time?
Yep, 4 and 6, please. Yep.
4 and with 7 or
Harm.
Yeah, 4 and 6. Is that agreed? Agreed. Margaret.
Agus Eireann Tála, that's the Pusnua. And like other people have said here, we really hope you succeed. Most importantly, I suppose, the people with disabilities themselves and their families and caregivers. But I'm going to talk about a very specific issue. It's around triage for young adults with additional needs in emergency departments. I'm just going to give an example. Lauren is a young adult from Leitrim with Down syndrome. Like many young adults with Down syndrome, Lauren occasionally suffers from episodes requiring medical assessment beyond the scope of that which can be provided by her GP. Since becoming an adult on 2 occasions last year, Lauren's GP advised her family to bring her to the emergency department. Once in Mullingar, once in Cavan, to determine whether treatment was required. Before she was 18 years old, Lauren had always been assessed as a child, and if any of us know who've had children attend the ED, we know that children they're assessed and they're moved on, whether onto the paediatric ward or at least a more comfortable environment, much more promptly than the adults waiting. In her 2 admissions last year, though, Lauren was an adult and she was treated as such by the staff as she passed through the triage system, which determines the urgency of the case. However, the prolonged nature of this experience has had a profound and negative experience upon Lauren. I just want to, I suppose, commend Lauren's mother, Maura, who I know very well, who has been a huge, strong advocate for her daughter on this behalf. For 12 hours late at night, Lauren sat in the emergency department until her parents were able to gain permission from a nurse to go home for the evening and return the next morning without losing her place in the queue. During that time, Lauren was exposed to aspects of life that she was unequipped to process or to deal with. Some people with Down syndrome are hypersensitive to what is going on around them. Lauren is one such individual. She's both caring and she's sensitive. This caring, sensitive young adult saw people who themselves were in very large distress and in pain. She witnessed scenes which left her with a sense of disorder. She witnessed some very, very unwell people, some people under the influence of intoxicants, and some people were actually handcuffed by the Gardaí. Lauren was very clearly distressed by this, and as she was leaving, a very kind hospital staff member apologised that she was exposed to these scenes, but they made it clear that they were severely limited in what they could do to lessen the experience. But Lauren, now nearly 6 months on, has not fully recovered from this incident. She experiences panic attacks and has difficulty in sleeping. 2 unwelcome developments which Lauren did not suffer for before this experience. So I'm asking you, I suppose, to work with the HSE and to have a wide review of how adults with learning difficulties or additional needs are triaged. Triage is defined as a preliminary assessment of patients or casualties to determine the urgency of their need for treatment and the nature of the treatment required. The capacity of an individual to deal with the immediate environment clearly impacts the urgency of their needs and should therefore, in my opinion, should form part of the triage assessment. It's not appropriate that adults with additional needs are treated in the same way as other adults while awaiting assessment, and it's also clearly not appropriate that they're treated as children because they're not children. Failure to acknowledge and act upon these 2 realities demonstrates the way in which we as a society do not always look beyond the meeting the needs of the majority. It does not benefit anybody to treat everybody exactly the same. It does not benefit the adult with additional needs who may become distressed and disruptive while waiting, and it does not benefit the adults with no additional needs who are also exposed to and absorb that distress. Equality does not mean identical treatment. Equality means giving everyone what they need to reach the same destination. In this case, satisfactory access to treatment and discharge. Equality demands that adults with additional needs have those needs met. And I suppose that can be as simple as having a staff member who from time to time circulates the emergency department and assesses the mood of the needs of those present. It may mean providing a more homely area room, and I know often we're limited within those with additional needs and that their families may be able to wait in a more conducive environment. But failure to act, I suppose, through ignorance, because often this doesn't come up because often, I suppose, people with Down syndrome themselves aren't often able to say. So we rely on their advocates and their caregivers and parents, and a lot of the time, to be their voices. However, now that we've raised the issue, I really hope, Minister, that you will take this on board, because I know that not only since Lauren's mother brought this to my attention, other parents with children with Down syndrome and with additional needs have brought this to, and I suppose it's a simple thing that could be done very effectively. Garmaga.